Up until relatively recently, wasn't even recognized. The veterans came home traumatized, dealing with a lot of the after effects, and were told to suck it up. It's awful that they weren't given the support, and it's still awful that veterans aren't given the support they need.
Well, thank you, and thank you for coming down here. So, like Rick said, I'm Rick Ward. I'm the Veteran Service Officer for Otero and Benton County. There's approximately 2,000 veterans in those two counties. The vast majority of them suffered trauma of some form or another, whether it's PTSD, military sexual trauma, and it doesn't have to be combat related. A lot of the times it's non-combat related trauma, training accidents, assaults, and other things that occurred to them while they were in the service. Going with that, a lot of them have substance abuse issues. They're self-medicating. They don't want to go in, they don't want to admit they have a mental health issue, that they need professional care. So they self-medicate either through drugs or alcohol or both. We're Brad Rill, I'm going to get him up here in a minute, talk about him, but Brad and I work closely together on trying to get veterans into the services to address their mental health concerns and, you know, prevent suicide and those other things, incarceration. I've got veterans in prison and in the county jails right now that I'm working with.
And what's the veteran suicide rate compared to the average suicide rate?
We're higher than the average.
Yes. I think it's 2x.
And I just sat through a meeting this afternoon at 1 o'clock, and Colorado has the highest veteran suicide rate in the country. Wow. But we also have some of the highest veterans population in the country. We have 6 active duty military installations in the country. El Paso County has a veteran population of over 100,000. So it's probably one of the highest veteran populations in the country. So we have a large veteran population. Going along with that, we have the highest suicide rate in the country. Just under 10%. We also deal with homelessness. We don't like to think we have homeless veterans out here in the rural areas, but it's a reality. When I first took this job 4 years ago, I didn't realize it existed, but it does. And unfortunately, we do not have the resources here to quickly house those veterans, to find them emergency shelters or things. So that's something we need to work on. You know, that's all hand in hand. You know, veterans with trauma, with mental health issues, drug and substance abuse issues, and homelessness. Those are the challenges.
And domestic violence.
And yeah, the domestic violence ties in with that too. You have somebody that's suffered trauma, they get angry, they lash out, they're high, they're drunk, and they get into an altercation. And then they end up visiting with one of Sheriff Mobley's deputies. And it's a vicious cycle.